My name is Wezzie Sichali. I'm from Malawi. I work with Mitundu Community Hospital. I was recommended by the First Lady for this Merck Foundation African Oncology Training Program. In my country, Malawi, we have a lot of challenges as in terms of fighting cancer. First, it is due to the human resource, as we do not have enough human resource. We have very few oncologists and we don't have nurses who are specifically trained in oncology care, such that we only use our basic knowledge that is learned during our tertiary education, and we implement it in managing the patients with cancer. Another problem that we have in my country is we do not train oncologists. This is a factor that is leading to us not having enough oncologists in my country, as we depend on training them or sending them overseas, and due to the economy factor in my country, we cannot manage to train a lot of oncologists. Hence, this is leading to the reduced number in the human resource in my country that is affecting the oncology care. In my country, Malawi, the treatment modalities we have is chemotherapy and surgical procedures in helping to remove some of the cancer tumors, but we do not have radiation therapy. But when it comes to chemotherapy, we do not have all the medications as in pertaining to all the cancers. Some patients are left untreated if the type of chemo they're supposed to receive is not available. They are placed on palliative care due to lack of the resources that we're having in the country. Having a new cancer center in Malawi, there are chances that we might also be giving radiation therapy. And coming here and gaining the knowledge in radiation and the management of these patients on radiation was part of a great experience, as we're going to give back to our country. We're going to be mentors to our friends, and when this radiation treatment comes in my country, it is going to be a great experience for everybody, as it is going to improve the cancer treatment. Another thing that was also an exposure was the different types of targeted therapies, chemotherapies that are here in India, as it seems that India has a lot of chemotherapies. So being exposed to different types of chemotherapies, their side effects and the management was a very good experience, as some of these experiences we do experience them in Malawi, but we do not know how to manage them, or we do not identify them as side effects. So being on this program, it was a very good exposure, as we are going to be able to identify some of these things and be able to manage them accordingly. As one way of fighting cancer in the world, I would advise all the new aspirants of this training program that this is a very good career path, as we want to join hands in fighting cancer, and that we must work hard. When we're selected for the program, we must put all our effort, work hard, and make sure we learn more and practice more and research more in fighting cancer. So this is a very good training opportunity. Firstly, what I would suggest to improve cancer care in my country is by training more oncologists. By increasing the human resource in my country, we're going to have a good diagnosis, good management and treatment of cancer. Because lack of knowledge, we can't fight cancer. We need the knowledge in fighting cancer. I would also suggest for lobbying for resources, because we only provide chemotherapy and surgical procedures in fighting cancer in my country, and we do not provide radiation. So if we provide radiation, it is going to be a complete cancer treatment, and we're going to fight cancer and improve the survival rates. So having been on this program for 3 months, we've learned a lot. And when I go back to my country, I'm not going to keep it to myself. We're going to have a feedback program where we're going to have all the staff, those who work in the oncology, in one place, give them the information, be a mentor. And when I mentor them, we're going to improve the patient's care by implementing these strategies we've learned here on the patients, thereby improving the care of patients in my country. I would like to thank Merck Foundation, firstly, for being on this platform. I know it wasn't easy. There were a lot of applications, but being successful and being on this platform to practice this and to be on this fellowship for 3 programs was a very nice experience for me. So I won't leave it unnoticed to thank the foundation. Secondly, I would also like to thank the foundation for the scholarship, as it was a very huge thing. We couldn't make it on our own with our own funds, but it was a free gift for us. And in thanking them, I would also like to say it shouldn't only stop on us, but this program should be recommended, like I recommended, that they should continue to do this even for the rest of our friends, that we can help in improving the cancer survival rates. Malawi.